Hello, today I'd like to present next story of the Before series, Before the Pill. Before, when someone was taken ill with anything more serious than a cold, the first effective recommendation that one might have heard was to see a doctor. Everything used to start with a GP and tests. It was necessary to take all kinds of tests and examinations and to wait for the results. When everything was ready, following the established procedure, the pathomedical record made its way to the therapists, whose purpose was to interpret the data obtained, to come up with a diagnosis and to tailor a suitable treatment plan. Medication, physiotherapy, daily routine, physical activity, and similar recommendations would make up the traditional and standard list for most non-critical psychological disorders for a common man. In some cases, it was much more complicated. One had to take examination on bulky and, as we proudly branded at the time, high-tech medical devices. Incomprehensible abbreviations and words such as CT scan, MRI, ultrasound implied the need for experienced specialists understanding the subtleties and intricacies of examination methodology to work with such devices. Medical equipment was expensive and few hospitals could afford it. More than that, in some countries, such devices were available only in large state health centers, and those who needed additional research had to queue for up to several months. But even then, technologies already allowed us to take a look inside ourselves, to see human organs in sufficient detail, to understand their condition, to obtain digital data, to exchange information remotely with other specialists, for example, with more experienced doctors. Human blood and other various biomaterials tests became more and more accurate and detailed. It would seem that the results of the tests gave all the answers even without additional interpretations and study by doctors, including by those same therapists. If an indicator was still inside of the reference values, there you had the result, healthy and sound. There were also those who thought they knew everything better on their own. They would diagnose themselves in line with the descriptions of the similar conditions on the internet, would find a treatment program in the recommendations. It's worth saying that such a system had a certain potential. Self-healing really sometimes worked better by the will of circumstances, but unfortunately things didn't always work out well. The internet was, of course, a good and useful thing, but common knowledge had it that in that source of world wisdom there was plenty of garbage and pseudo-healers who would know everything for sure. There was more than enough of techniques proven on thousands and thousands of patients around the world. Often, self-medication based on unverified and unprofessional recommendations would lead to sad, simply fatal results. When it became obvious that there was no way to do without specialists, the patients would turn to the doctor, but it was hardly possible, if at all, to help. The disease would happen to be neglected, to such an extent that it was only possible to get rid of it by prayers and a miracle, and not without applying some practical scientific knowledge. Sometimes, even in such situations of irresponsible neglect, it was still possible to save patients, but such cases were exceptional in a series of crippled and dead.